Hello, my name's Kenneth Brown. I'm a senior at Texas Tech and I live in Sanger, Texas right now. For the senior project thesis, final research paper, I picked the topic of hydration in athletes. This was something that I'd kind of seen firsthand from past years of playing baseball and football and basketball, and then also being a major of kinesiology previously. So I did something that I had a little prior knowledge onto, and then something that I also enjoy doing to end the semester. Um, to start off my paper, I used multiple sources. I used the Texas Tech library online. I used Google Scholar, and then I also had some old textbooks from kinesiology that I pulled some facts from, and also used um, a little bit of marketing that I found online. I didn't really cite that in my paper, but I used it more as a reference and more to show a relation of how athletes perceived hydration in that sense, instead of just using more of a factual base. So during the paper, I kind of state my complex problem or issue of how does a common known wellness practice such as hydration still affect an elite athletes and professional athletes. I kind of also added a little more. It wasn't a one type question based paper. I also went into later on, after stating that first problem, was how does hydration affect athletes? What's the prevention of it? Um, what do athletes perceive hydration as? And then how does the industry of sports deal with hydration? That can be anywhere from medical staff, advertising, how they teach athletes hydration, and how athletes know what hydration is. So, I briefly talked about some very interesting facts that I found on the topic, actually. I thought one that was kind of eye-boggling to me, and I thought helped support the need to find an answer for this question, is that between 1997 and 2006, the increase of heat-related injuries that are due to hydration increased 133%. So over a matter of a 10-year frame, 133% increase in heat-related injuries. So in that article, this was actually by the Sports Safety Statistics. It talks about how hydration and heat correlate together. Many medical staffs aim to help individuals optimize their levels and muscle growth and stamina and recovery, and they all have the basics of hydration. So, many athletes and some articles that I originally, to start out my research and kind of decide this was what I wanted to really research on, was they talked about how their careers have been shortened due to hydration issues. That can be because cramps or something like that causes the muscles to become weak, and then once that happens, it is very easy for a major injury such as ACL tear or UCL tear in a pitcher. During the literary review, I chose to use two disciplines, and that was sports management and physiology. So, each of these disciplines correlate with the human body, which applies to the topic due to hydration affecting the athlete's body. The discipline of sports medicine, which I'll give you brief definitions, a field of medicine concerned with the prevention or treatment of injuries and disorders that are related to participation in sports. So that is just saying that's more of your sports-related side to hydration. And then physiology is a branch of biology that deals with the functions and activities of life or of living matter, such as organs, tissue, cells, and the physical and chemical phenomenon involved. So that discipline is going to give us a little more in-depth version of hydration, not just from the sports side. So sports medicine discipline talks about um, how strength and conditioning staff members and the or kinesiology department have researched hydration. Um, they have shown that they've done research on the fluid level intake versus the fluid level outtake during activities. In the research, it shows maintaining a baseline of hydration is a must. So whatever athlete size, shape, they need to keep a baseline hydration for their certain body to maintain high performance. This discipline also talks about how dangerous it is for the athlete, not just the human body, but it goes into more of an athletic analysis, which states that when an athlete is performing, they're actually sweating at a very, very higher rate than what an average person would be in like a gym setting. Okay, so the Athletic Trainers Association also has a base meetings they hold as they call them, every year, and they inform new athletic trainers on hydration risk, and they give out pamphlets to give to athletes. And then one of the statements that kind of correlates to that is from 2000, and it's Casa, who in most of these articles of hydration, has a great input in it, even on the other discipline that I talked about too, besides sports medicine. They said fluid replacement beverages should be easily accessible throughout sports. So meaning that during and after, before, there should always be hydration for the athlete. They should consume about 7 to 10 fluid ounces every 10 to 20 minutes when exercising. Some athletes need more, like I said previously, and then sodium too. So a lot of people think water is the answer to hydration, which it's not necessarily is. We need to implement sodium. Sports medicine shows us the risk involved. Like I said earlier, what can happen when we don't hydrate. The sodium levels could decrease, our muscles become weak, and they can break or tear. And the other discipline, physiology, gives us a more scientific approach to the complex problem athletes. There's a really good article or a findings that I found was in the Journal of Applied Physiology, which I had multiple sources and multiple citations out of that. It states that I thought was very interesting was that when you ingest drinks, there's certain drinks you should have. And a misconception of consumed drinks is alcohol. Alcohol is actually stated in there not to be as big a factor as most people think, and that's just due to the sodium. So we think as alcohol would dehydrate you, which it does, but alcohol also has so much sodium in it that it kind of maintains a base level there. So later on in the article, it actually talks about alcohol is not a suggested consumption drink for athletics. So that's just saying that you can drink alcohol and not get dehydrated outside sports, but if you're an elite athlete or athlete wanting to succeed, probably stay away from alcohol. So on the more of the physiology side, they say that oxygen that is received by muscles and exercises decreased strength of these muscles. The blood flow to these muscles support the strength at beginning stages, but later become weak due to dehydration. So when we go into more detail, what happens in dehydration? It's weakening the muscles. So dehydration has greater effects to the body, such as to the brain. Brain can have contugious injuries. The concept discussed by Kempton is one of the ventricular is very important due to having the risk of dehydration at all times. When playing at high physical demands and having size requirements, athletes become really vulnerable to dangerous settings. So that's saying that this is going more in depth, saying that it's not just muscles, not structural. Dehydration can cause brain injuries. So during the literary research, it shows the direct relation that hydration on performance of athletes by sports medicine. Discipline provides an actual application to previous and future treatments in performance setting versus physiology is the information more of a clinical setting. So all the research did, they kind of split. One was clinical and one was an applied method, I would say. Analyzing and evaluating insights or theories. The complex problem of dehydration, it is shown that in sports medicine and physiology provide both precautions, applications, and results. Post issue to hydration. I think one of the best piece of information that kind of sets up the whole paper is that hydration solution would contain mineral salts and vitamins to replace the loss through sweating. It's stated from nurses that it's one of the best ways to maintain hydration. So during the research process, it's apparent that these athletes are required to put their bodies through extreme, sometimes dangerous situations. These athletes have shown to use the rehydration method in many different ways. So some of them will take like pills, or they'll take actual supplements. They'll drink liquid, or they'll eat stuff that has help rehydrate them. But some of the issues in the theories between the two disciplines is that sports medicine has more of a approach when doing research, showing that they want the athlete to be on the field, and they don't really want to examine more in depth. So they will treat them for the minute or acute dehydration, but they're wanting to get them right back on the field right after. So versus physiology, they have a clinical setting, so they'll actually, when these people go through dehydration in these clinical settings, they allow them to kind of recuperate and then go again after that, not immediately throw them back on the field. It's not a business setting, it's more of a scientific, getting a better reading or better research on the matter. So that was the biggest conflict in between the two that I found. I think that's mainly it. Besides, there's some applications of how to stay hydrated, like fluid amounts and what type of fluids they should have. But between common ground, I think the best thing was that each discipline used a color scale of urine, which is kind of weird if you think about it, but they have these signs, or they tell patients or athletes in both settings that the color of urine tells you if you're hydrated or not. So that's a big, really easy test when in both disciplines that show, okay, if you're hydrated, the darker the urine, the more dehydrated you are. So clearer urine, more hydrated. That's a big thing in both. And then that they both talk about replenish hydration during and after. The sports medicine side was a little bit more of preparation than clinical, because clinical, we normally get people in these settings that are already hydrated. So for the conclusion of this research topic, I would say, to answer our complex question, is that athletes or any individual suffering from hydration, normally it was from being pre-dehydrated going into the activity. So preparation, 1. 2 would be not replenishing throughout activities, and 3 would be the post-hydration. So having the information from both disciplines has helped us determine that hydration is somewhat of a choice, but it's also a very chemically brought up issue, that hydration in athletes is from sodium levels, it's from what they eat, it is from their body size. So that's a big thing we learned too, that some recommendations show that individual of 180 pounds should drink 10 ounces of water every 30 minutes, but a person of 225 pounds should drink the 10 ounces every 15. So that's a big difference. We're just different bodies do different things. And then reflecting on the findings throughout the research, the complex problem can be answered. Each discipline plays a valuable role in providing insight to the hydration process from a real-world approach and a controlled environmental or clinical approach. Having both disciplines be able to kind of have common ground but have their differences was a great tool to finding an answer to this. And hydration, I think the biggest thing we need to realize from this is that hydration affects more than just the athlete today. It affects them tomorrow if their body becomes weak. In the professional setting, their performance goes down, and that ultimately hinders their ability to make salary, make an income, and that hurts families. that hurts their lives. Sometimes we see them as performers, but they are humans, so they're trying to do everything they can to stay on the field.